Alexa, thank you so much. 8:33. The United States has one of the highest rates of maternal mortality of any industrialized country. And while the overall numbers, they have gone down slightly in recent years, there's still a big gap when it comes to racial disparities.
Take from your retina the ones that you use to see me. And when you get lost,
He said,
when you go far, I'm close.
I would rather your son pass away in your arms than with us working on him. We have done everything.
Black mothers and black babies really need help in order to take this journey, this pregnancy journey.
The documentary film, The Ebony Canal, gives us an intimate and sometimes, as you just heard, heartbreaking view of the journey to motherhood within African-American communities. Emmy Award-winning director Ime Alaquiva joins us this morning along with Black maternal health advocate Kimberly Seals-Allers, who's also featured in that film. Good morning to the both of you.
Good morning.
Good morning. Good morning.
Well done.
Yes.
That opening scene that we actually saw, that mother, and she's one of many mothers,
Yes.
sadly,
Exactly.
who lost their babies in many circumstances in preventable situations.
Very preventable.
But beautifully captured, but you gave such reverence to these stories. It opens as well, showing mothers in their most beautiful, capturing their maternity photos in the water. There's so much expectancy,
Yes.
right? Pregnant with joy, pregnant with so much possibility, and then oftentimes that's stifled.
Yes.
In this film, though, we are confronted with mothers living without their babies as well living without their mothers.
Yes.
Why did you choose this avenue to talk about this overall crisis?
Yes, as an artist, we have to do our job at telling the truth. And, this is my love letter to Black and brown women and birthing people around the world. And if I'm an artist that's really about this life, I have to really dig in to make sure that the clinical matches the cultural. So this is a very artistic, journey at being able to say, hey, listen, we got to do something about this. And it's just not one sector of individuals, but it's going to take all of us to be able to, be a champion for Mariah, for
Yes.
Alana, for Larissa, for Rachel, and all the Black and brown mothers and birthing people. This is what we need to do.
Right, so many mothers, so many babies. You talk about a vocal mom, Viola Davis, who has been so vocal about her journey in motherhood. Is that
Yes.
why you chose her to narrate this film?
Yes. Viola, she saw the trailer, a 3-minute trailer, and literally jumped on. She cleared her schedule and she said, listen, I'm going to be a champion. I'm going to be an advocate for this. And just along with Viola, as well as, a lot of other individuals that was a part of this, it's going to take all of us to be a vessel, pun intended. I named it the Ebony Canal, of course, ebony being a dark shade. Canal, when you connect one body of life to another body of life, it's going to take all of us to come together and to really provide the foundation of a solution.
Right. Kimberly, you've been in the advocacy space here for so long, talking about everybody coming together. You created a forum, an app to do just that, because like you said in the film, the math isn't mathing when it comes to the progress that we hope to see.
Exactly. And I think what we have to remember is that the CDC has already said that over 80%, particularly of Black maternal deaths, were preventable. And so if something is preventable, but it's not being prevented, what can we do? And this is why Ime's film is so important. Our stories are really a part of how we get to justice, right? Our stories, and whether they're being beautifully displayed through a film or the stories that we capture in the Irth app that we turn into data to work with hospitals here in New York City, but also all around the country, and to really drive more accountability and transparency. So we are capturing reviews, ratings, stories through the Irth app from birthing people, from new parents, from pregnant folks, and we use that so that people can search and see, what do other people like me say about my experience at this doctor, at this hospital? We can keep each other safe, we can inform each other, and then that back-end data now becomes a tool to transform systems, and that's the work that we're doing here in my city, but also all over the country.
Absolutely. And we know these forums are very female-centered because mothers, they have the birth canal essentially, but fathers play such a crucial role, of course, in this process and support during and of course after. Why did you want to spotlight fatherhood? It's not a voice we often see and hear from.
Yes. It's so important to include fathers. You know, with the work that Charles Johnson's doing in Atlanta for Care for Moms and other programs, it's important to know that we have a say. You know, we're not to be pushed out during the 9 months and say, hey, listen, return after we give birth and things of that nature. But it's crucial to understand that we are all vessels. And, you know, when you think about water and when you think about birth, when, a woman's water breaks, that's how you know that change is coming. So fathers are a part of that change that's coming, and it's all important that we get in.
Absolutely. Kim, you have done so much work. You know that there's a lot of movement on the state, on the local level. Again, we're not seeing the numbers we would like to. So where do you think the change needs to come? Where is the core? Is it getting into the actual healthcare system, changing the way people are trained and how they interact with African American mothers?
Well, I think there are two things. One, we have to acknowledge that I always say America is, we are a country that's obsessed with choice. But unfortunately, when we birth, we don't have much choice. And so we really need to create alternate systems, which could include midwives, right? Birthing centers. What are some other options? Because actually these other options have been proven to reduce our maternal mortality and infant mortality rates. What are we doing about access to doulas? Our city and state has been very forward in making sure that we have access to free doulas, or that doulas are covered by your health insurance. So these are all the supports that we know are needed for that birthing person to have the outcome that they deserve. And then our work is holding the health system accountable to do that. So they may take that training, right? They may take that anti-bias training, but who's going to check in to see whether that training improved the patient experience for Black and brown folks? And that's where Irth plays, to really hold systems accountable, while on the front end, giving ourselves that rating and review platform, that Yelp-like platform. Because we know we're not going to a 2-star hotel or restaurant or anything anymore. We use that tool, and we need to use it to keep each other safe.
Exactly. We have it. We might as well use it for good.
Absolutely.
Amani, this film is absolutely getting the impact it deserves. Already nominated for 3 Webbies. Congratulations.
Yes, 3, not just 1, not just 2, but 3 Webby Awards. It deserves to be seen by as many individuals as possible. And it's all about the impact. With the Ebony Canal, we're going to continue on this journey for solution-driven practices. And, I'm just thankful for everyone that came across and that helped to bring this to the next level.
And where can people watch the film on their own?
Yes. So right now we're on a festival run, then an award tour, then we're hoping to land Netflix or Hulu. And we just, want people to be a vessel, logging on to the ebonycanal.com and joining this fight.
Ime, Kimberly, thank you so much. Job well done. And make sure you do check out the film. It is so moving, so gripping. Thank you for continuing this conversation on African American maternal health. We'll be right back.